Now, there are two entities which is called as lamellar or encysted hydrocele. So we will see the differences. First, we have lamellar pleural effusion and we also have encysted pleural effusion. So we will see how both of them will look. Okay. So first, lamellar pleural effusion. Okay. In lamellar pleural effusion, first we will draw the lungs. So this is the right lung, this is the right lung, and this is the left lung. Okay, this is the cardiac heart border, and these are the diaphragms. Okay, now we have like this. In lamellar pleural effusion, actually the pleural effusion will look linearly or lamellarly, which is the pleural effusion or opacities is seen, this pleural effusion is seen parallel to the lateral aspect of the lung. Here in lamellar pleural effusion is seen parallel to the lateral aspect of lung. This is one thing which will tell us that there is lamellar pleural effusion. Okay, so actually this is the picture showing the lamellar pleural effusion. Even here there is blunting of the costophrenic angle is definitely present. There is blunting of costophrenic angle, this is for sure. But along with that, you will also see that this parallel, this fluid which is seen parallel to the lateral aspect of the lung. So here you can see the fluid parallel to the lateral aspect of the lung. This is a case of lamellar pleural effusion. This is actually a case of lamellar pleural effusion. Okay. Then we have to see what is an encysted pleural effusion. So let me draw a picture for encysted pleural effusion also. So next, encysted pleural effusion. So we have the lung. This is the right lung and this is the left lung. Okay, this is the dome of diaphragm, cardiac diaphragm, and this is the dome of diaphragm. Now, the difference is that here this encysted pleural effusion is actually here the fluid is accumulated along the fissure. The fluid is located within a fissure in encysted pleural effusion. So, for example, we have a horizontal fissure here, right? Now, the pleural fluid is actually pleural effusion. The fluid is located along this fissure, like this. Okay, so this is called as encysted pleural effusion, where fluid is seen within the fissure. So if you see here, this is an encysted pleural effusion where fluid is seen within the fissure. Then this is also a case of encysted pleural effusion. See, this is encysted pleural effusion. This is actually a horizontal fissure. Along the horizontal fissure, we have one encysted pleural effusion, and along the oblique fissure, we have another encysted pleural effusion. So these are the different types of pleural effusion. Okay, then we have one more type of pleural effusion, which is called as subpulmonary pleural effusion. The next type of pleural effusion is actually subpulmonary pleural effusion. In this subpulmonary pleural effusion, here, as the name says, here the pleural effusion is present below the lungs. Okay, here the pleural effusion, or here the fluid is present below the lungs. That is subpulmonary pleural effusion. This subpulmonary pleural effusion is easier to detect on left side than on right side. Why? Because on left side easier to detect on left side more commonly than the right side. Why? I will tell you. See, this is the right lobe, right lung. This is the left lung cardiac border. Okay, this is the left lung. Okay, this is the dome of diaphragm, like this and like this. Now, there is effusion is present, but here the effusion is not filling the recesses. Normally, it should fill the costophrenic recess, right? But what happens is the effusion here is present below the lungs. Okay, below the lungs, the effusion is present. Because the effusion is present below the lungs, one thing that happens is that this diaphragm position will vary. I'll show you. See. Here, this is present below the lungs. So, the diaphragm will become a little lower, right? Like this, right? Here, if you see, this is subpulmonic effusion, number one. In this subpulmonary effusion, pleural effusion, one thing if you see, in the diaphragm, below the diaphragm, we have a gastric bubble located here. Okay, normally the space between the lower border of the lung and the gastric bubble is less. But here, in subpulmonic pleural effusion, the space between the lower border of the lung, or we can lower border of left lung, lower border of the left lung and gastric bubble. The space between the lower border of the left lung and gastric bubble, this space is increased. This space is increased. That is one reason why we can easily determine that there is a subpulmonic pleural effusion on the left side than on the right side. Because on the right side there is liver. The liver and the opacity of the liver, the I mean, radio opacity of the liver and the opacity of this pleural fluid both are almost similar. So as a result, it is difficult to diagnose the subpulmonary pleural effusion on the right side than on the left side. On left side, whenever the space between the lower border of the left lung and the gastric bubble increases, then it is subpulmonary pleural effusion. Now, this space between the lower border of the left lung and gastric bubble, normally it is less than 7 millimeters in most of the patients. If it is more than 7 millimeters, always think that there is some type of subpulmonary pleural effusion noted. Now, if you see on the right side, it is very difficult to distinguish between the normal right dome of diaphragm and also this subpulmonary pleural effusion. But one way to distinguish on the right side is that if there is a lung here on the right side, the dome of the diaphragm will be like this, right? Because of the liver will be like this, so the dome of diaphragm will be like this normally. But similarly, if there is subpulmonary pleural effusion, how does this look? In subpulmonary pleural effusion, if this is the lung, here this is the lung, so you will have this uniform dome of diaphragm. See this dome of diaphragm, and here whenever there is fluid present between the lung and the liver is normal. Liver is like this only. Okay, liver is normal, but there is fluid present between the lung and the liver, and as a result here the border looks something like this. That means the normal dome of diaphragm is altered here. So the main way is the one of the major way to distinguish between subpulmonary pleural effusion is the highest The highest point of dome, the highest point of dome of right diaphragm, it is present laterally. So if you see, this highest point is present laterally, but here the highest point is present centrally. Normally, the highest point is present centrally, but whereas in subpulmonary effusion, the highest point of dome of diaphragm is present laterally. So if you see here, the highest point of dome of diaphragm is present laterally rather than centrally. So by that way, we can distinguish between a subpulmonary pleural effusion on the right side. Whereas as already said, on the left side, the subpulmonary pleural effusion is detected by gastric bubble. Because the space between the left dome of diaphragm and the gastric bubble, this space is more than 7 millimeters, then obviously there is some subpulmonary pleural effusion. So if you see some pictures, this is also a pleural effusion, but here the pleural effusion is present along the horizontal fissure. So this is encysted fluid. This is actually fluid present along horizontal fissure. So whenever a fluid is present along the horizontal fissure, then obviously it is an encysted pleural effusion. Then here if you see the distance between the left lung, that is lower border of the left lung, and the gastric bubble is definitely more than 7. It is more than 7 millimeters. Because this distance between the left lung and the gastric bubble is more than 7 millimeters, we can say this is a case of subpulmonary pleural effusion on the left side.